Hello guys, welcome to today's session on Circle of Willis, Anatomical Variations, Collateral Flow and Stroke Risk and Neuroimaging. So, this presentation will provide a clear, concise and clinically relevant overview of the brain blood supply, focusing on the anterior and posterior circulation system and the Circle of Willis and the critical concept of watershed regions. Accurate knowledge of vascular anatomy, including common variations, is essential for interpretation of neuroimaging, localizing neurological deficits, and planning interventions in conditions such as stroke and neuroaneurysms. In this session, we will explore about the major cerebral vessels and their segmental anatomy, the circle of Willis and its common variations, how these variations impact stroke localization, CT and MRI interpretation, and treatment planning. Now the anterior circulation, that is the internal carotid system. The ICA is the major supplier to the brain and its journey is divided into the cervical part, petrous part, cavernous part and the cerebral part or supraclinoid parts. And these are the main part of the ICA, and the main branches of the ICA are the ophthalmic branch, posterior communicating artery, anterior choroidal artery, and the terminal branches are the ACA and MCA. So this is the DSA image showing this is the ophthalmic artery, this is the PCOM, anterior choroidal artery, and terminal branches are the ACA and MCA. Now the variations of the ICA are the hypoplastic ICA or fetal origin of PCA. That is the PCA, posterior cerebral artery arising from the ICA instead of the vertebrovascular system. And these are clinically significant as they alter the collateral flow in the brain parenchyma. Now the anterior cerebral artery, the ACA is the crucial for the medial brain supply. Its segments are the A1 segment, that is the first segment from the ICA to ACOM, and the A2 segment distal to the ACOM coursing along the corpus callosum. See, this is the A2 segment, and A3 to A5 segments are the pericallosal and callosomarginal segments. So these are the coursing around the corpus callosum. And the most common variants are the azygous ACA, that is the single ACA supplying both hemisphere, and the hypoplastic A1 segment. So these are the most common variants of the anterior cerebral artery. We can see in this DSA image, that is the ACA is coursing over the corpus callosum. This is the first segment is the A1 and this is the A2, and A3 to A5 are the pericallosal region. So these are the branches of ACA. The main branches of the anterior cerebral artery are the anterior communicating artery, medial lenticulostriate artery, recurrent artery of Hebner, and the others are the orbitofrontal artery and frontopolar artery, that are the branches of the A2 segment, and anterior internal frontal artery, middle and internal frontal artery, and posterior internal frontal arteries are the branches of the ACA, whereas the superior parietal and the inferior parietal arteries are also the branches of the ACA. This is the DSA image showing the same branches. Now these branches supply the corpus callosum, septum pellucidum, and the putamen anterior portion, and the head of caudate nucleus, and the part of the internal capsule. So these are the branches which supplies the different part of the brain and deep nuclei. The middle cerebral artery. The MCA is the most commonly affected vessel in ischemic stroke due to its broad cortical distribution. It is divided into the four segments, that is the M1 segment. This is the horizontal segment or the sphenoidal segment, and it originates from the ICA to the insula and giving rise to the lenticulostriate arteries. M2 is the insular branch and the branches courses over the insula and supply the deep structures. M3 is the opercular branch. This is the M3 opercular branch and it supplies the operculum, and whereas the M4 is the cortical branch and this supplies extensively the cortical surface of the frontal, temporal and parietal lobes. And the common variations include the duplicated MCA, accessory MCA or early bifurcation of MCA, which can influence collateral flow and the presence of the stroke risk. And this is the second image. We can see that this is the M1 segment, horizontal segment, M2 segment, that is the insular, M3 is the opercular segment, and M4 is the cortical segment of the MCA. Now the posterior circulation or vertebrovascular system. So the vertebral arteries are the most important part of the vertebrovascular system. There are a pair of vertebral artery on either side of the neck. So vertebral artery ascend through the neck, uniting to form the basilar artery. They have four segments: V1, that is the preforaminal; V2, foraminal within the transverse processes of cervical vertebra; V3 is the Atlantic around the C1; and the V4 is the intracranial before joining the basilar artery. A crucial branch is the posterior inferior cerebellar artery or pica, which supplies the cerebellum and brainstem. And variations of these artery includes the hypoplastic vertebral artery or unilateral dominance artery, which can predispose to ischemic events if the dominant vessel is compromised. So we can see in this image is this is the V1 segment, V2 segment, that is the foraminal segment through the foramina of transverse processes. V3 is the Atlantic, so around the C1, and V4 is the intracranial segment, and this is the basilar artery. This is the CT angiogram image showing the segment of the vertebral arteries V1, V2, V3, and V4 segments. Now the basilar artery. It is formed by the union of vertebral arteries. The basilar artery runs along the ventral pons, bifurcating superiorly into the posterior cerebral artery. And its branches include the anterior inferior cerebral artery, that is ICA, and the numerous pontine arteries supplying the pons, and the superior cerebellar artery, so SCA. So these are the main branches of the basilar artery, and these supply the critical brain stem cerebellar structures. And basilar fenestration or hypoplasia are main anatomical anomalies of the basilar artery, and these can impact cerebrovascular dynamics and lead to the critical role in stroke and aneurysm formation. Now the posterior cerebral artery. The PCA primarily supplies the occipital lobe, part of the temporal lobe, and the thalamus. It is divided into the segments: P1 from the basilar bifurcation to the posterior communicating artery; P2 within the ambient cistern giving up the thalamoperforating artery; P3 is located within the quadrigeminal cistern; P4 is the cortical branches that perfuse the occipital lobe and the critical for visual processing. The fetal type of PCA is the significant variation of PCA, where the PCA predominantly arises from the ICA via the PCOM rather than the basilar artery, and this alters the collateral pathway in case of the basilar system compromise. So we can see in this image, this is the P1 segment, P2 segment within the ambient cistern, and this is the P3 segment within the quadrigeminal cistern and the occipital lobe. This is the angio showing this is the P1 segment, this is the PCOM. So proximal to PCOM is the P1 segment, this is the P2 segment, P3 segment, and this is the cortical branch. Now the circle of Willis, a most important structure of the vascular supply of the brain. It is a collateral network of vessels, and the circle of Willis is an arterial anastomosis at the base of the brain, formed by the A1 segment of ACA, the ACOM, terminal ICA, the M1 segment of the MCA, P1 segment of the PCA, and the PCOM. So this forms the hexagonal structure, allows for the vital collateral blood flow, potentially compensating for the compromised flow in one of the major feeder vessels. This is a very important structure of vascular supply of brain. We can see that this is the annotated image showing the circle of Willis. So this is the ACOM, A1 segment of ACA. This is the internal carotid artery ICA, M1 segment of the MCA. This is the PCOM, and this is the P1 segment of the PCA. So this is the structures forming a hexagonal shaped vascular network. This is the circle of Willis. We can see in this image, this is the ACOM, A1 segment of the ACA. We can see this the A1, ICA, MCA, PCOM, and P1 segment of the PCA. So this is the vessels forming the circle of Willis. Now the clinical and radiological relevance of the segmental classification is, it is very crucial in angiographic evaluation, stroke localization, and endovascular procedure for the treatment of the stroke or any vascular pathology. So variations explain the atypical stroke patterns and influences the surgical planning of the management of the intracerebral vascular pathology. Now the common high yield exam points for the intracranial vessels are the MCA is the most common stroke artery. ACA supplies medial, frontal and parietal lobes. So this affects the leg area. PCA supplies the occipital lobes. So this affects the vision. And fetal PCA variant alters the collateral circulation. So these are the high yield exam points. Now the watershed region in the brain. So what is watershed region? Watershed region are the areas where the territories of two major cerebral arteries meet, making them the particularly vulnerable to ischemia during the periods of reduced cerebral blood flow. Understanding these zones is crucial for the diagnosis and managing the specific stroke syndromes. So these are the two types. That is the cortical, that is called the external watershed zone, between the ACA and MCA in frontal and parietal convexity, and between the MCA and PCA, posterior parietal occipital convexity. And there are another type is the internal or subcortical watershed zone, seen between the deep and superficial MCA territories and between the MCA and ACA perforators in the central semiovae. So we can see in this image, this is the cortical watershed zone, this is the internal watershed zone, and this is the posterior cortical watershed zone. Now the radiological features of the watershed zone, in fact, so CT MRI appearance is linear or wedge-shaped in fact in cortical junctions, and a string of pulse pattern in internal watershed, in fact, that is the clusters of small lesions, and this shows the DWI diffusion restriction, and the MR perfusion shows the reduced blood flow and the blood volume in the infected area. So we can see this is the blue denotes the cortical watershed zone, anterior and posterior, and this red and this blue line is the internal watershed zone. We can see that this is the wedge-shaped diffusion restriction in posterior aspect, whereas the string of pulse sign we can see in this the internal watershed zone, in fact. Now the clinical relevance of the watershed zone infection, that is the ACA and MCA watershed zone, in fact, shows the man in barrel syndrome, where we can see that the proximal arm and leg weakness, and the MCA PCA watershed zone, in fact, lead to the visual impairment such as the cortical blindness or visual field defect and higher cortical dysfunction, reflecting damage to the posterior parietal and occipital lobe. The internal watershed infection, these infects affecting the white matter, then that can result in a range of symptoms including cognitive impairment, executive dysfunction, various motor deficit depending on the specific white matter tract involvement. We can see in this image there is an internal watershed zone, in fact, which is denoted by the perfusion imaging, which shows the reduced blood flow denoted by this blue color. Now, anatomical variations in intracranial vessels and their clinical significance. Up to 80% of people exhibit some form of the variations from the standard Circle of Willis anatomy. And this holds the profound clinical implications influencing the disease presentation, diagnostic interpretation, and the therapeutic strategies in cerebrovascular conditions. Understanding these variations is not merely academic, it is crucial for accurate diagnosis, effective treatment planning, and the precise assessment of stroke risk and collateral circulations. Now the key variants and their frequencies based on the CTA studies. Now most common is the fetal origin of posterior cerebral artery, that is PCA, 37%. This is the MR angiogram showing the fetal PCA. This is the PCOM and posterior cerebral artery. P1 segment is not visualized. Now another one is the hypoplastic A1 segment of anterior cerebral artery, that is 17.6%, or absent A1 segment, that is 0.4%. This image showing the absent A1 segment. Now, azygous ACA is 1.5%. In this image we can see there is a azygous ACA, that is single ACA supplying both hemisphere, and hypoplastic A1 segment. This is the azygous ACA. Arterial fenestration 2.4%. This is image showing ACOM fenestration as well as the M1 segment of MCA fenestration. Now the clinical implications of these variants in stroke and ischemia risk. So, as CEE occlusion lead to the bilateral frontal lobe ischemia, fetal PCA and carotid atherosclerosis lead to the risk of the PCA territory ischemia, and the hypoplastic or absent segments are severely impaired collateral circulations, and atypical stroke presentation influences the brain perfusion patterns. Fenestrations and duplications lead to the turbulent flow and increases the shear stresses and lead to the formation of the aneurysm, whereas the aneurysm must be differentiated from the anatomical variants, that is the infundibulum. So infundibula is the benign funnel-shaped widening at the vessel origin, often mimicking the small aneurysm, as we can see in this image. This is the outpouching noted from the this vessel. This is the pecum infundibula, that is the funnel shaped dilatation of pecum at its origin. Impact of anatomical variation on surgical and endovascular procedures. So complicated catheter navigation in variant anatomy during endovascular procedures extremely difficult, prolonging procedure time and increasing the risk of vessel injury or dissection. So preoperative imaging is very essential. Why? Because it allows for the precise identification of all intracranial vessels, including persistent embryonic arteries. Example, persistent trigeminal artery, which if unrecognized can lead to the severe complication. So imaging is essential to avoid such complications and guiding safer interventions. Conclusion of this video lecture is the intracranial anatomical variations are not anomalies but common occurrences that occur clinically significant in the context of cerebrovascular disease. This improves the precision of diagnosis, enhances the accuracy of risk stratification for the stroke and other vascular pathologies, and significantly increases the safety of neurointerventional and surgical procedures. Understanding cerebral vessel anatomy and its variations is key to accurate stroke imaging and clinical decision making. Thank you for watching this video. Don't forget to like, share and subscribe this channel to get more radiological insights.